Hi, Dr. Melissa Kaufman. Thank you for being here in behalf of SMU. We are very honored to have you here having this conversation. Uh, uh, you are a very good role in the American Urology Guidelines, and it's an honor to have you here. But thank you very much. I would like us, if you could guide us through what are the changes or the main challenges for urologists in treating a post-genitourinary syndrome, post-menopause genitourinary syndrome.
Thank you so much. It's really my honor to be here. It's been an absolutely amazing meeting with an incredible depth of expertise nationally, internationally, and the hospitality has been fabulous. So it's really my honor. When we talk about genitourinary syndrome of menopause, the very fact that the American Urological Association developed these guidelines was pioneering. It was a bold move, and it's really going to transform the way that we treat many of these women. So typically, when we think about the types of women that we see in practice, women with recurrent urinary tract infections, women with urgency, frequency, overactive bladder symptoms, we were treating organ specific just to the bladder. But in fact, the role is that the problem may be genitourinary syndrome of menopause. And what we found is that this is a very broad array of signs. So the woman will come in with some symptoms of dyspareunia, of pain, just general pain in the vagina and the vestibule, along with urinary symptoms of urgency and frequency and urinary infections, along with the signs that you see on physical exam. So when we developed these guidelines, we wanted to be very methodical about the fact that this is a shared decision-making process between the patient and the provider to ensure that we give them the best options for treatment, but they're the ones that are in charge of making that choice eventually. So this has been the narrative, of course, for most of our guidelines and most of the ways that we now interact with patients. But when we do these types of interventions for these women, it's really imperative that we do a physical exam. And because these are postmenopausal women, in many ways, it's difficult. It may have been many decades since they've had an intervention like this. And so doing it really with trauma-informed care is important. And when we talk about why this is so critical now, it's not just all the urology types of issues that come on, but across the spectrum of all pathologies for women, it's really promoting women's health. And the hope is that these guidelines have actually been transformational in developing a new narrative in our country, in legislation. There was a landmark decision that happened just last week in the United States where our Food and Drug Administration actually removed the black box warning on estrogens, and we hope that part of it was because of the data that we had accumulated to show the safety profile of use of these. We used to just call this vaginal atrophy.
Exactly.
Nobody wants to hear that they have an atrophied vagina, right? So about 2014, there were two societies that came together in a consensus statement to define genitourinary syndrome of menopause. And when we think about, well, who's that patient population? Well, typically, we think about older women who really are postmenopausal. But in fact, this can be women, young women, who have undergone treatment for breast cancer, undergone treatment for other pelvic cancers. It can be women who are breastfeeding, women who are on oral contraceptives, and all these women can benefit from treatment. And you ask, what's the main treatment? It's really supplementing vaginal estrogen, right? Being able to give back vaginal estrogen. And we have so many different formulations, so we can find the one that's right for the patient. Because if they don't use it and they don't adhere to the therapy, then it's not going to work. And as my dear friend Rachel Rubin says, till death do us part, you have to continue using this therapy for long term. But we have many options. There's other types of hormonal interventions too that also deliver testosterone locally, and this may enhance other aspects of the vulva and of the vagina and help with general vaginal health. But for women with recurrent urinary tract infections, for women who are suffering from overactive bladder, all our guidelines are now congruent to say that supplementation with vaginal estrogen is important.
So it seems to me that there's a lot of new evidence that
Yes.
promotes treatment, and on the other hand, there was like a gap of knowledge because it's like maybe data was misread, and then we need to
Absolutely.
relearn how to treat, and especially let patients know, well, here in Mexico, and I'm assuming in the United States as well, let them know that the treatment is not going to be harmful.
That's exactly correct, and that leads into with the fact that in these guidelines, we made a number of statements based on that, and we hope that's what helped push our Federal Drug Administration to actually reverse their ruling about the black box warning, because we looked at the data, and we have very strong statements that vaginal estrogen does not increase a woman's risk of developing breast cancer. It does not increase their risk of developing cardiovascular disease or dementia or all the things that was on the black box warning. But it's even safe in women who have a history of breast cancer, women who have been using selective estrogen receptor modulators, women who are using aromatase inhibitors in a shared decision-making process with their oncologist are still candidates for this therapy. We found no change in the endometrial lining. We even addressed that. And for women who are very, very reticent to utilize any hormonal intervention, and you can imagine there are many, we looked at all the non-hormonal interventions. And although moisturizers and lubricants can be used and can be used safely, they're not a surrogate for vaginal estrogen. And although laser therapy, which has become very popular, is also not a surrogate for vaginal estrogen. So there wasn't a strong amount of data, but if it's a shared decision-making process and that's what the patient desires, then it's appropriate treatment.
Yeah, and tailor the treatment, no? Especially.
Absolutely. And that's what we focus on in these guidelines, is tailoring that treatment for the patient.
So definitely something to keep in mind around the context of having new guidelines. Hopefully, as a urology community, we are learning how to treat our women better. Many thanks for this interview, Dr.
Thank you so
Kaufman.
much. I appreciate it.
Thanks.